I think we can get started. So thank you everyone for joining us today. Again, my name is Agata Bednarska. I'm the Outreach and Education Manager for the World Trade Center Health Program Clinical Center of Excellence at Mount Sinai. We're one of few clinical centers within New York and New Jersey metropolitan area providing medical monitoring and treatment to 9/11 rescue and recovery workers defined by as a drug law as general responders. We're pleased to have you with us and appreciate you taking the time to join us tonight. Our goal for today is to learn about how the flu spreads, why first responders are at higher risk, and how the vaccine helps protect against serious illness. We will discuss recent research and CDC updates, including why vaccination is especially important for those with lung and heart conditions. We will also cover everyday ways to help prevent the spread of germs and keep yourself and others healthy. Our guest speaker for today is Christina Mattson. Christina is a board-certified adult gerontology primary care nurse practitioner and oncology certified nurse with more than 15 years of experience in clinical care and nursing leadership and program development. She currently serves as a clinical program manager at the World Trade Center Health Program Clinical Center of Excellence at Mount Sinai, where she oversees clinical protocol development, quality assurance, and care coordination for over 22,000 9/11 first responders. She holds Bachelor's of Science in Nursing from Mercy College of Health Sciences and then Master's of Science in Nursing from Hunter College, and is currently pursuing her Doctor of Nursing practice at Hunter College as well. Christina has contributed to peer-reviewed publications and participate in international medical missions. It is now my honor and pleasure to introduce you to my colleague, Christina Mattson. Christina, take it away.
Thank you so much, Agata. Hello, everyone. I'm so happy you're here with us. As Agata mentioned, my name is Christina Mattson, and I've been a clinical program manager here at Mount Sinai for about 10 years. It really, truly is a privilege to spend this time with you. In that next little bit of time, we will talk about ways to stay healthy during this flu season with a focus on the flu vaccine and other simple steps that you can do to make a big difference. My hope is that you will leave today with a little more clarity and confidence about protecting your health this flu season. So here is how we will spend our time together. We will start by talking about the flu, how it spreads, and the impact on the United States. We will then continue with why vaccination matters. And we will share some everyday prevention tips that are easy to put into practice. And then from there, we'll go over some common questions that we frequently receive about the flu shot. And finally, we'll touch on the support that will be offered at Mount Sinai. And then we'll end with some time for questions. So as we go through each section, I just encourage you to think about how this information connects to your own experience and really what matters most to you as you protect yourself this flu season. So what is influenza? Influenza, or commonly called the flu, is a respiratory virus that tends to show up every year during the colder months. It spreads through droplets when someone coughs, sneezes, or even talks. And it can also spread when we touch a surface and then touch our face. I just want to draw a comparison to COVID because COVID does spread in many of the same ways, but there are some important differences. Like the flu, COVID spreads through droplets when people cough, sneeze, or talk. However, COVID can also spread more easily through those very small particles that can stay in the air longer, especially in indoor spaces and with poor ventilation. So for many, the flu causes a week or so of feeling achy, tired, and run down. But for people with existing health concerns, flu can lead to some more complications. So that's why we really want to take this seriously. Every year, millions of people in the United States come down with the flu. In the 2023 to 2024 flu season alone, the CDC estimates that there were about 40 million illnesses, 18 million medical visits, which resulted in 470 hospitalizations and unfortunately 28,000 deaths from the flu. For most, the flu is uncomfortable but manageable at home. But for others, especially those with breathing issues, heart conditions, or weaker immune systems, it can be more serious. As responders, many of you are already managing long-term health conditions, which makes taking extra care during the flu season even more important. By preventing the flu, we are not just avoiding a week of feeling sick. You're protecting your overall health and preventing any complications that could affect your work, your family, or your quality of life. The flu shot is one of the simplest and most effective ways to reduce the risk of getting seriously sick. Even if it does not prevent every single case, it helps make the illness much milder and lowers the risk of needing hospital care. During the 2023 to 2024 flu season, the CDC estimates that the influenza vaccination prevented about 9.8 million influenza-related illnesses and about 8,000 influenza-related deaths. The CDC recommends getting your flu shot by the end of October, prior to peak flu season. This will give your body the time it needs to build up immunity from the vaccination. The flu vaccine also helps protect those around you, including family, coworkers, and friends. For you as responders, vaccination is really an extra layer of protection for your health and well-being. Let's take a look at why flu prevention is especially important for people with ongoing health conditions. For those people with lung problems like asthma, COPD, reactive airway disease, this can trigger increased breathing difficulties. It can cause the flu to develop into pneumonia, which is a more serious lung infection. If you are living with heart disease, it can raise the risk of heart attacks. It can worsen heart failure. For those with diabetes, the flu makes it more difficult to control your blood sugars, which can cause further complications. And for anyone with a weakened immune system, the flu can mean a longer and more difficult recovery. By protecting yourself against the flu, you're giving your body one less battle to fight. So in terms of covered vaccinations, the World Trade Center Health Program covers several different preparations, including the standard dose injection. There is a higher dose version available for those who are elderly or maybe immunosuppressed or immunocompromised. And we also cover the nasal spray preparation at the pharmacy. It's really important to know that, safe, effective choices are available, and your provider can guide you toward the option that is best for you. I highly encourage you to, have a discussion with your healthcare provider about what vaccine is most appropriate for you and your health needs. I did want to quickly comment on thimerosal. It has been in the news recently. Thimerosal is a preservative frequently used in multi-dose vials of vaccination. Single-dose vaccines and the nasal spray frequently don't require preservatives and therefore do not contain the thimerosal. In my 20 plus years in healthcare, I can say I don't think I have ever seen a multi-dose vial of the flu vaccine. So really don't want that to be a reason for people to be concerned. So aside from vaccination, there are other everyday things that people can do to help you keep the flu away. Try to avoid close contact with people who are sick. If you are not feeling well, it is best to rest and recover at home. Disinfect surfaces and wash your hands often, especially after being in public places. Cleaning surfaces like phones and doorknobs is a really simple habit that can make a big difference. Avoid touching your eyes, nose, and mouth, as the germs just spread so much quicker that way. And remember to cover your coughs and sneezes, either with a tissue or with your elbow. Sorry. Masking is another tool that we can use to help reduce the spread of the flu, especially in crowded or indoor spaces. This can be used to protect yourself if you are immunocompromised, or if you're feeling unwell, you can wear a mask to protect others from catching the disease. These small steps all add up and help protect both you and the people around you. All right, so next we just have some common questions that people often ask with the flu and the vaccine. So one question people often wonder is, if I get the shot, can I still catch the flu? The answer is yes, it is still possible. But the vaccine makes the illness less severe and lowers the chance of any serious complications. I like to think of it like wearing a seatbelt. It doesn't prevent every accident, but it greatly reduces the risk of anyone being badly injured. Another common concern we see is side effects from the vaccine. Most side effects are very mild, like a sore arm, some fatigue, a low-grade fever for a couple days. This is just your immune system building protection. Serious side effects are very rare. Sometimes people might say, I got the flu shot once and I still got sick. Often what people call the flu may have been a different virus, like a cold or stomach bug. The vaccine is designed specifically to protect against influenza. You might have also heard some myths, such as, this flu shot can give you the flu. Also, this is not true. The vaccine does not contain any live flu virus in any form that can infect you. What it does is train your body to recognize and fight off the virus if you are exposed. Vaccination is needed every year because the flu strains do change and protection fades over time. Sorry, excuse me. So by getting a flu shot annually, you're keeping your immune system ready to fight off any potential flu infection. So at Mount Sinai, our priority is your health. Flu shots are available through the World Trade Center Health Program and can be given at your scheduled monitoring and treatment appointments. This year, we will also be providing educational handouts in the clinic to answer any common questions or concerns and share tips for keeping you healthy. Our team is also here if you would like to talk through any concerns about the flu or flu vaccination. So if you already have an appointment coming up, ask about getting your flu shot while you are at the clinic. For those of you who do not have an appointment during flu season, the World Trade Center Health Program covers flu vaccination at your pharmacy. This is available to our members with a World Trade Center certified condition. If you do not have a World Trade Center certified condition, the flu shot is still available to you through other coverage at many other places in the community, such as local pharmacies, your union or employer, or through your primary care provider. Vaccination is just one way to stay healthy. Everyday habits like washing your hands often, covering those coughs and sneezes, cleaning frequently touched surfaces, and resting at home when you are sick all make a really big difference. Whether through vaccination, healthy routines, or ideally both, each step you take helps protect you and those around you during flu season. So as we discussed, influenza can cause further complications of chronic conditions. So please protect yourself and your loved ones from the flu. And at this point, I'd like to open the floor to any questions anyone may have.
Thanks so much, Christina. This was really helpful. There was one question around, and I think you addressed that in your slides, if I get the flu shot but still catch the flu, what is the difference does the vaccine actually make in between those two? So can you just reiterate the message around that?
Sure, that's a great question. Thank you so much. So, the flu shot can't prevent every case of the flu, but it does make a big difference in how your body responds. People who get the shot still can catch the flu, but they usually have a much milder illness with fewer days of symptoms and a lower chance of serious complications like pneumonia or hospitalization. Again, I like that analogy of the seatbelt, where it can't stop every accident from occurring, but it can greatly reduce the harm if it happens.
Thank you. Another question that we had was around, and I think you briefly spoke about this as well, around chronic conditions and vaccinations and flu. The question was specific to, I have asthma and sometimes worry about how flu might affect me. Why is vaccination especially important for people like me with chronic 9/11 health conditions?
That's another great question. So, people with chronic conditions like asthma, COPD, diabetes, they're at higher risk of flu complications. The flu can trigger asthma attacks, worsen breathing problems, raise the chance of a heart attack, or make it harder to keep blood sugar stable. Vaccination lowers these risks and gives your body extra protection. So for responders living with these conditions, getting the flu shot can mean the difference between recovering at home and potentially needing to be hospitalized.
Great. And there was one question, what would be the best time of the year to get the flu vaccine?
Yeah, so the CDC recommends getting the vaccine by the end of October. So there is a waning protection. So getting it in October will carry you through to the later stage of the flu season. So I personally get it in October and recommend that to my patients.
Great. And can you just reiterate how our patients, when they do come in to see our providers for a monitoring visit or a treatment appointment, how they can inquire about getting the flu vaccine?
Absolutely. During your IAMQ with the nurse, they will ask about flu vaccination. And if you would like it during your monitoring appointment, you can bring it up at that point. If you're coming in for a treatment appointment, you simply just need to mention it to your provider, and there'll be a flu nurse that will be able to give you the vaccine.
Great. And I think last question that just came in was around hand sanitizers. How helpful are the hand sanitizers as far as prevention?
So they are helpful. They work well. The best is going to be to wash your hands with soap and water. However, sanitizers play a very important role in this world where we might not have a sink right next to us. They're, a nice alternative, but hand washing is still the best.
Great. So these are all the questions. Thank you, Christina, so much. Thank you for all of you who joined. This webinar is recorded, so we'll make sure to post the link on our website and share with those who couldn't join us tonight. And if you do have any questions, please let us know. You can always reach out to us. Our phone number is 212-241-1554. That's our call center, open Monday through Friday. And yeah, thank you all so much. Thank you, Christina. This was really great. And have a great evening, everyone. Take care.
Thank you so much.
Thank you. Bye.